take a few notes to start off today, then we'll do the lab from Thursday that we didn't finish. You close the blinds so you can see that better.
You said finish Thursday?
Yeah, on Thursday we started a lab that we didn't finish.
No, like, finish a chapter?
No.
Oh, the lab, okay. The rulers are up?
We mentioned this earlier. We talked about, different neuroglia. We talked about astrocytes. We talked about oligodendrites. Which one, do you remember which one connects the capillaries to the blood, to the neurons? So there's a connection in the brain and the spinal cord. It's this right here that connects the neurons to the capillaries. It protects them from toxins. Remember the name of this is?
Astrocyte?
Astrocytes, very good. So it's an astrocyte which connects, and this is a capillary right here. So capillaries are about 1 red blood cell thick in diameter. So it allows just really that one blood cell to get through. So they're very easily blocked. But they bring oxygen, nutrients to the brain, to the spinal cord, and they take out toxins from those areas. But if you didn't have the astrocytes, then you would have a lot more toxins go into the neurons in your brain. And you have a lot more damage to the neurons, which would be a big problem because you can't repair, you can repair neurons to some extent, but if they're dead, you can't replace them. So once they're gone, they're gone. And so they have to be protected because of that. So the blood-brain barrier is a name for basically the astrocytes that keep out toxins from the neurons, from the brain. So the least permeable blood capillaries. Permeable means letting things pass through. So they don't let very much pass through. Now they do let certain things pass in to the neurons in the brain. Water, glucose, blood sugar, and amino acids. And so diabetes, when you have too much blood sugar, that would go into the brain. That can cause damage to the brain and to the nerves. So there are certain conditions that it cannot prevent, and that would be one of them.
So is this all talking about astrocytes or not?
Basically, the blood-brain barrier is a name for what astrocytes make up, which would be the barrier which keeps neurons safe from toxins and anything that could harm them. And so there are certain things that can pass through, like glucose, which can cause some damage if there's too much of it. Also things like alcohol, caffeine, antihistamines like Benadryl can pass through. And so those are some example of things that can cause changes in the brain or damage to the brain because they are not blocked by the astrocytes. So the idea, though, is that it excludes toxins and waste. So the idea would be to keep out toxins and waste from getting into the brain cells and in the spinal cord. Yes.
If you have like blood get into like your brain, would that be bad? Like if you have bleeding?
Well, if you have an open, if you have bleeding and it's not stopped, that definitely is a problem because you have swelling that starts to happen. The brain doesn't have much room to expand. So if you have any kind of swelling, which would include bleeding, then the cells would start to die off. They would be squished and they would lose oxygen. So the bleeding itself wouldn't be the issue. It'd be more of if you lose blood flow to part of the brain through a stroke, for example, then the brain cells die that way. Or if you have too much blood building up in the brain, causing pressure on part of the brain, then the brain cells are starved of oxygen and they die from that. There are two reasons where it could be really serious. So there are certain things that it cannot prevent from passing through. So fats, fat-soluble molecules, those can pass through. And alcohol, for example, is able to pass through because it can work on fats. It's able to dissolve in fats. Other things that are like caffeine is organic, that can pass through as well. So any drug that changes your behavior is able to pass through the blood-brain barrier. So things like nicotine, heroin, morphine, those all are able to change the functioning of your brain and your nerves.
So they don't count as toxins?
Oh, they are. It's just that they can't. So it takes out toxins, but it can't take out every toxin.
Okay.
So there are certain toxins that, like alcohol would be a toxin for the body. It cannot take out that toxin. Well, it's not able to prevent it from going through.
So why is it not able to prevent certain toxins?
The ones that are able to dissolve in fats
Oh,
can pass through. So caffeine, alcohol can dissolve in fat.
so caffeine is a toxin.
In large amounts it is. It can kill you. Yeah. Like
Wait,
no.
what was that like when Maddie had to like?
She had to go to the ER. Yeah, she and she didn't even have, like, if you think about how much she had that's killed, she didn't have a deadly amount, but she definitely had a lot. I think I forgot what she said she had.
It's
Um,
like a lot of Red Bulls
I-
and coffees.
It wasn't a Red Bull.
Oh,
No, it was, I think it was like 8 coffees is like what I think, like the amount that she had told 8 coffees. I think she had like 2 venti Starbucks drinks, if I remember, which is about, I believe, 8 coffees.
But I feel like that's not.
But
So maybe
But it was,
it's
she
not-
didn't eat very much either. She had not eaten for a
Wait, so what
while.
happened?
She went to the ER
She, like,
because she was really, really sick.
What did they do then? Did they like flush
They
it
just
out?
gave her IVs, you know, because she was dehydrated and she needed food. So it's kind of scary, but she was proud of it though.
She was like telling me that at a football game, and I was like,
Oh my
Maddie, and she
gosh,
was like,
that's her favorite story to tell people.
Yeah, and he almost died.
Yeah.
He's still here.
I see her like holding 4 cups of like the biggest Dunkin' Donuts size coffee like all the time.
Yeah, she loves that.
It's
Yeah.
a lot of milk, yeah. I mean, I guess.
Yeah, I mean, it's not, yeah, I mean, it really, I mean, the amount was not really that harmful. It's because she hadn't eaten that really made it harmful.
Didn't that also happen to Hannah? Like she had coffee one morning and.
Well, she's gotten really sick, but not like to the point of being hospitalized. But yeah, I know she has been, like, she gets really shaky. With even like a little bit of coffee, she gets really shaky. Yeah.
That's like
Um,
the biggest espresso drink you can get in Venti. It's like 6 is
Yeah, that's a lot. But you know, so people don't die from drinking coffee, but they can die from drinking caffeine powder. You know, so it's not as common as it used to be. They can order pure caffeine. People put into their drinks, and that can be deadly and very easily deadly because even about a teaspoon would can kill you. And so people don't measure it correctly. But that has been
Is
fatal.
that what's in caffeine pills?
Caffeine pills, yes, there's caffeine in it, but it's not pure caffeine in the pill. It's able to be, you know, it's a safe dose. But if you have too many of that, you could also die from that. But yeah, if you take the right amount, it's fine.
What's the
But-
like caffeine pill, amount of caffeine in a caffeine pill versus like coffee?
I think it's about the same. I mean, it depends on the kind you get, but I think it's meant to be about the same amount, like 200 milligrams at most in a caffeine pill. But the amount that becomes deadly for caffeine is about 1 gram, which is 1,000 milligrams. That's equal to about 10 cups of coffee or so. That's when it can become deadly, yeah. But it depends on the person, their body weight, their metabolism, how much they've had to eat. But for most people, those can be more than that, but that's when it starts to become deadly, about 10 cups of coffee. And that'd be like one after another, like right, you know, it wouldn't be throughout the course of several hours. It'd be, you know, right. It'd be like really fast. You know, yeah. So it's hard to physically drink that much coffee to the point where it becomes a problem. You have to take caffeine pills or caffeine powder for it to really become really serious for you. All right, concussion. So I mentioned this earlier, but what happens in a concussion is that, you know, we mentioned this last week, that your brain's in fluid and it never touches your skull. The brain is suspended, it's floating. And so it's not supposed to touch any part of your skull. But when you hit your head really hard, then the brain does hit your skull. And the act of it hitting your skull changes how it functions. It can change how it works chemically, electrically. And if you distort your brain to the point where it doesn't work as it used to, that's concussion. So it doesn't mean that there's bruising, it doesn't mean there's bleeding. Contusions are when you have bleeding and bruising. A concussion is a non-physical injury, which means, you know, you've touched your brain, you made your brain impacted your brain to the point where it doesn't work like it used to, but you won't see a physical sign. So you can take a CAT scan of concussion, you won't see anything that changes. You can't see it on a CAT scan. You can see it on a PET. You can see, as your brain functions, you can see how your brain changes its functioning, but you can't see a physical sign of injury with concussion. Contusion, though, you do see a physical sign of injury. You do see bleeding or bruising, but not with a concussion.
How do you get a contusion?
A contusion, usually just like a worse brain injury. That's where you do get bleeding and bruising and
So
swelling.
it's like
Hold on, just give me a second.
a concussion is a lesser version of a brain contusion.
Generally, yes. I mean, there are two different kinds of injuries. Basically, it's talking about like a sprain versus a bruise. I mean, they're talking about two different things. So is a sprain worse than a bruise or vice versa? Well, it depends. It can be, not always. So in general, yeah, contusions are usually worse than concussions, but not always. Sometimes concussions are worse than contusions. There are two different kinds of injuries. They do have different effects. But usually contusion, you go into a coma usually. That's, so you,
Even if it's not
Wait,
the frontal
contusion is
lobe?
bleeding in the brain, right?
yeah.
Even if it's not. the
Can you
frontal
feel
lobe?
it depends. It really just depends on where it is. Sometimes their contusions, they're fine for a while. They're talking normally, they're acting normally, and they just like knock out, like they just pass out really fast, and they're in a coma for a while.
No, you're not
It's-
like in pain.
It depends. You can be, yeah, it can be deadly, yeah. Especially if you have lots of bleeding or swelling in the brain. So they're usually worse than concussions. They generally are they're more of an emergency than concussions. So yeah, they can be deadly. They can be very serious. But for concussion, it's a brain injury that changes the way the brain functions. So again, you've hit your brain, that makes it change how it works. So it makes the signals change. It changes the chemical nature of the brain. Now, again, you don't see physical changes. So the neurons themselves are not going to be damaged with the concussion. Well, they can be if it's a more severe injury, but on their own, the neurons themselves are not damaged, but they do change their functioning. And that's what happens where, you might feel woozy, you might not be able to concentrate, you might have mood swings, you might not be able to see clearly. Those are all signs of concussions, where your brain's not able to work the way it used to. Most concussions, though, don't lead to permanent damage. They can, but usually one concussion on its own does not lead to permanent damage. But the more you have, the worse the damage becomes. So if you just have one concussion on its own, generally you're going to be fine. But if you have multiple concussions year after year, that can lead to serious problems. And that can lead to life-changing, it can lead to migraine, it can lead to depression, it can lead to mood swings. It just depends on where it's at and how many you've had. Probably heard about CTE before, chronic traumatic encephaly, where you have brain injury that, concussions one after another. NFL players especially, I think there was like a recent shooting that they think is, did you hear about that?
Recent what?
Recent shooting. There was a football player,
And he had that.
and he probably, but they don't know, but they think he might have, because he shot 7 people. And
Wasn't it like that dog?
it just happened, like just the other day.
Was that like where he shot the doctor and stuff, or was this a different one?
I don't know who it was, so it might have been a doctor. All I know is it was 7 people. I don't know. I don't know if he was in the NFL. I know he was a football player, but I'm not sure it's NFL. I think he was.
He shot 7. Wait, what?
That's all I know. And that they think might have been brain injury that
Like,
made
in
him
the hospital or-
do what?
Like, when did he shoot 7 people?
It was just the other day. It was just like 1 or 2 days ago.
Was he in the hospital or something?
Why is this not?
I don't know. I mean, I don't know. Well, yeah, I don't know much about it. That's really all I know. And that probably what happened is he had brain injury, which made him, become violent. That's generally what seems to happen with traumatic brain injury, is that they're not themselves anymore. They get depressed, or they have a lot of anger and they don't know what to do with it. Let me see. So he's in custody. April 8th. Okay, so this is earlier than I thought it was. It was in Bryan, Texas. Not that far from here. So he's in custody. 7 people were shot at a cabinet shop in Bryan.
Any fatalities?
I think they all died. Wait, 1 person died. 4 are critically wounded.
That's probably why it's not manageable.
Yeah, that's all I know about it.
Wait, did you hear about like I think it was like 2 weeks ago or something about that mother like in her baby killed 2 of her daughters?
No, I didn't hear about that.
Well, like she like separated them in her house or something, and then she drove to the police station and from in there called 911 herself, and like they like did scans or like something, and apparently she had like split personality disorder because like she kept saying that she was trying to save them from herself.
Oh yeah, that happens a lot.
Like the mother
Yeah.
side of her was trying to save them, so then she ended up killing them, and then she called them on herself.
That's so sad. Yeah, it's just, it happens sometimes, and when a lot of people who do kill, they're not mentally stable, and that's why they do that. And it's just awful. But yeah, I've heard of those cases before where they have split personalities, and
Yeah.
that's what drives them to do that.
What goes on in the brain when you have split personality?
Usually what happens is that you've had trauma in your life. Usually something really terrible has happened to you in your life. And
That could cause you to act like a bunch of different types of people.
it could be anything, but it could be all kinds of trauma. But basically it's just very disturbing trauma that really, it's so awful you don't know how to process it. And so you start compartmentalizing things. You start to just put things in one part of the brain you cannot access. And that then becomes your personality. And then you have different personalities based on what you have to do. Like there was this one case I heard of this woman who was, she was abused as a child. She was basically kidnapped and human trafficked for a while and just, but they made her kill this little dog one day. And they just did terrible things to her. She was like 8 years old. And so she had to become, in her mind, this different person to do that. And so she became this other, she had names for different people, but
Yeah,
she,
I heard that they have names sometimes.
yeah. And so she was able to kill that dog in that personality, but then that wasn't who she was. And so then she would forget about it. And if she was herself, then she wouldn't have that memory. She'd only have that memory when she was that other person who killed that dog. Oh yeah, it's a real thing. Yeah. Yeah, that's pretty extreme. That's not like, so that's not really, yeah. It can be true.
It's literally this guy who has like 2 different personalities, and like one personality thinks he's like a woman, and then his other personality he like thinks he's a man, and he's like going in like to get surgery, like all this stuff, and it's freaky. Like he does different things with his different personalities, and when he's in his other one, he literally has no idea about.
Yeah. So that's part of what really, yeah. So that really can happen. And again, if you have severe trauma, then that is one way to cope with severe trauma. And that you basically cannot access those memories unless you are that personality. And if you're not the personality, you don't know that they existed.
Yeah.
And so it does happen. It's not very common. You have to really undergo really severe stress and trauma for that to happen. But yeah, that does, and people have different voices for the characters. They have different memories for the characters, and there's all scattered, and they don't really know their whole story. And so if you ask a person who has this, tell me your life story, they would have a lot of just missing pieces. They wouldn't be able to tell you certain ages, what happened when they were a certain age, and be able to, because they just would have no memory of that in that person.
Oh, so
But
when
then-
they're in their different person, like if they're in that for a certain section of their life, when they're in their other personality, they wouldn't have any memory.
That's right. Yeah.
So weird.
Mhm. But so like they'll talk to their therapist, and their therapist will know everything because they'll then get them to talk in different personalities. And so the therapist will know their whole story
It can never
over
be-
time, but the person won't
Yeah.
because they don't coexist. They're,
And don't you like have to coax out the different personalities? I don't know, it's just so
Yeah.
weird.
yeah, because they only come out when they're needed.
Yeah.
Like for the girl who killed the dog, that only personality, it was like a bad person. That only came out when she had to protect herself or had to do something really bad.
So aren't you aware
So-
that you have different personalities? Like, because
They're
I saw, like, an interview
told.
with this lady saying that like the other personality she named whatever comes out whenever she like someone is like attacking her, like not attacking
Yeah.
her, but like if you're in an argument, like the other personality comes out to defend her, and it's like
Right. So they can have a basic idea that that happens. They wouldn't know all the details of every personality. They wouldn't be able to, because that's the idea, is that they can't access every personality. But yeah, they would, in general, they would understand that they do that, and they would know, and basically the main characters that they have in their head.
What if like people, so if someone did like consciously realize that they had different personalities and that there were all these different aspects with that, they wouldn't actually have it, that would just be them like have the same.
Wait, I couldn't hear your question. So they had their personalities, and then they're deciding to have
So
them.
like they split and like, I know I have like all these different it's like, you know how people say, if you know you're crazy, you're crazy.
Hmm.
Like if you knew about that and you could actually separate them and realize, do you think that would be like something that was a choice rather than?
Well, it is a choice. I mean, it's basically how the human mind survives really bad trauma. And so, yes, it is a conscious choice to do this. They do it to survive. And they do it to forget certain bad things happen to them. So yeah, it is a choice, but it's if they didn't do it, they go crazy. It's a severe reaction to something that's happening to you, but it's how you're able to stay sane in that really bad circumstance.
Are you able to have more than two personalities?
Oh yeah, you can have a lot more than two. Yeah.
it's hard enough to have more. Okay,
Okay, so that was concussion. Now brain contusion, that's when you actually do have neurons damaged. And so that's when you do have bleeding, swelling of the brain. It depends on where you have brain damage, but if the brainstem is damaged, that can be very serious. That's, brainstem controls breathing, controls your heart. So coma and death would generally occur if you have brainstem damage. It would be very hard to survive damage to the brainstem. If you have frontal lobe damage, then that would be amnesia. You might forget certain things. You might forget how to do certain things, like, tying your shoe or riding a bike. But you would be able to survive that. So center brain damage and brainstem in the back of your brain damage are the worst. But coma is very common with brain contusions. If comas last for more than a couple of days, they're usually going to last for years. So the best chance of you getting out of a coma would be if it happens right away. But if they last for a very long time, more than a few days, then generally that means it's going to be for a very long time or for your whole life. It's hard to wake up out of coma if you don't get up out of the coma very quickly.
Was it Jordan Peterson in a coma for a year?
That was medically induced coma.
Okay.
They did that on purpose. So that's totally different. They purposely put them into a coma. So with brain contusions, the two main issues with this would be bleeding, called hemorrhaging, and swelling, called edema. And so that would be the two major issues. And that's why brain contusions are always going to be emergency, because the more swelling you have, the more bleeding you have, the more brain cell death you're going to have. And the worse your chance of getting better would be.
So I was gonna say, I didn't get the last two.
No.
Oh, yeah, me neither.
So this you can see in a CT scan. So this is a CAT scan, and this is visible on that because you're actually seeing visible damage for a contusion. So it depends. Generally, all they can do is relieve the swelling of the brain, and so if they need to, they could open it up so to pull out the fluid. But besides just removing the swelling, they can't do a whole lot more because brain tissue cannot really repair itself. And so, now what can happen though is if you do have brain damage, your brain can rewire itself. So it cannot replace the damaged neurons, but what it can do is recruit other neurons to take its place. Sometimes that can happen, or you can relearn how to do things as well. So you probably have all heard about somebody who's blind who gets better hearing. Because what happens is that the brain tissue understands, we're not using the auditory, we're not using the visual cortex of the brain. So the visual cortex of the brain becomes the auditory cortex. It starts, you get a larger area of the brain for auditory processing. And so they become better hearers. So the brain can do that with other things too. It can change, it's plastic in the sense that it can change its wiring so to help make corrections to parts that are injured. You can relearn how to do certain things, but there's certain, it's always going to be limited to what you can do if you have certain damages to the brain. You'll probably hear about people having strokes, and you've probably seen that afterwards they're not the same, and they can learn how to talk again, how to walk again, but it's going to be very slow. Yeah.
You know how they, some people built like a suit that you could wear for blind people that would like impress on their skin, and they could like feel objects that move in front of them. Could you make like, I guess, since the body's going to repurpose neurons, you can make like either something for your hands or your face, because that's where your most sensitive things are, that basically like pricks your skin and has a camera attached to it. So like you would have a mask that would prick your face whenever there was something that moved in front of you. So
No,
you
that could
feel
work.
it.
I mean, I haven't heard about that, but I mean,
No, I was
that
just
sounds
thinking of it
like,
because the project that I was describing earlier was just something that would prick your back.
let me
or,
see.
Like vibrate the skin on your back, but there's very little neurons back there.
Yeah, that's right. There won't be as much as on the face or on the hands. Yeah, I mean, that definitely would be something that would help, I think. Okay, so I mentioned a stroke. Let's go through what that is. So a stroke is a blood clot in your brain. Basically, part of the brain is deprived of blood. A stroke is also called a cerebral vascular accident. So CVA for short. It's very serious. It's a third leading cause of death in the US, just behind heart.
Not racism?
Yeah, gosh, yeah, that's up there.
What did you
But-
say? It's a blockage in the brain?
Do I know?
What'd you say it was, a blockage in the brain?
Yeah, basically it's a blood clot in the brain. Basically, you don't have blood going to parts of the brain. So that would lead to tissue death. And that is a very serious, it's an emergency. You have to go right away to get that blood clot removed, because you have brain tissue dying immediately if you don't have blood going to the brain cells.
What could cause a clot in the brain?
Different things. So you can have what's called embolism, where basically you just have blood, like blood that's dried up, and it just moves throughout the body. And that can be due to all kinds of different things. You could have some kind of injury somewhere in the body, and then the scab just goes into the blood, and it goes up and it gets blocked somewhere. You could have air somehow getting into the blood system, and that air could also lead to this happening. Certain medications can cause blood clots. Birth control pills especially can cause blood clots. The new vaccine, Johnson & Johnson, has been shown to cause blood clots. So
No,
yeah.
it's just very small.
It's a very small chance. It's like 1 in a million. But
The blood clots are what?
for the Johnson & Johnson vaccine, yes. For birth control pills, it's more like 1 in 1,000, which
But
is
they took Johnson away because it was having like.
1 in a million. Well, 1 in a million people had blood clots.
Wait, do
Yeah.
you know if it's immoral to take birth control for your, like, you know how sometimes dermatologists will like prescribe birth control?
Yeah, for
If
acne.
you're not
Yeah.
sexually active, is it?
No, it's
immoral?
perfectly fine to do that. Yeah, it's only, so the reason why you're taking it would be the issue.
Yeah.
And so, no, if you're not married, if you're not trying to avoid having children, you can certainly take it. Now, it is a very powerful drug. And so definitely it should be a last resort, not because of the moral issue, but just because it can cause a lot of side effects. So it can.
And like cancer and breast cancer.
It can.
and cause you to gain a bunch of
Yeah.
weight and make you
I mean, there definitely are a lot of bad side effects to it, but there are certain cases when it would make sense. So there are certain times when it would make sense to take it, where it'd be moral to take it and it actually could help you. So it's not bad in every sense. And there are certainly times when it would make sense to take it.
Wouldn't that kind of be supporting the companies that make it?
Well, yes, but that would be remote cooperation, you know? There's double effect, right? You know, you don't intend the evil. You don't intend to contracept. You don't intend to use that for a bad purpose. And so because you're not intending to use it for a bad purpose, and you have a good reason to take it, but so it definitely shouldn't be for frivolous reasons. I can't talk today. It should be for a good reason. But if you're taking it for a good medical reason, you certainly can, even though you are remotely supporting the company, that overrides that if you're taking it for a good medical reason.
What if you, I don't even know how to say this. What if
You
you
just
wanna,
say, if you don't want to get your period, you
Yeah.
take birth control.
Yeah, that wouldn't be a good reason.
that
Yeah.
would be a good reason?
No, you
Like, let's say
need
you
that.
have really, really
That's
bad cramps, like some people really
Yeah.
struggle with like cramps and all this problems.
Right,
Like, what if
yeah.
you just wanna get on the pill?
Well, okay, so if you just take the pill and you don't know why you're having this, that would lead to more serious problems. If it's endometriosis, if it's a cyst, if it's cancer, I mean, you want to know why. So lots of times doctors will just give you the pill and just say, you know, take this, you'll get better, but they don't want to understand the underlying reason why you're having those problems. And that's a lot more important to know why, because if you're not treating the reason, it'll just get worse and worse as you get older.
Like, it probably just like borderline some red cramps, like that problem.
Yeah, like it could be endometriosis, it could be a hormone imbalance, it could be a cyst in your ovaries. I mean, there's so many different things it could be, but you really want to know why. But doctors can just be lazy sometimes, especially with this, and they just be like, I don't want to know why, I don't want to figure out the reason behind it, just take this pill, you'll get better. And you don't want to do that. So it's an easy way out for the doctor. And you do want to go to a good doctor who's going to find out the root cause of why you're having such, because that's not normal.
But
To-
if you take it for, let's say you take it for your skin, like
Mhm.
if they prescribe it for like, how like dermatologists prescribe for skin. Like I know a lot of people who are on the pill and like it stops their periods.
Yeah, it does.
So like
Yeah.
would that technically be wrong if they're taking it for their skin?
No, if they're taking it for
Or
their
is it
skin and they have really
period?
bad acne, I mean, it's a nice side effect, but I mean, you know, I mean, but I mean, you shouldn't take it just for that reason.
Okay.
And also, I mean, it's important. I mean, you don't want to go for years without having a period because the uterus really is supposed to shed its lining. And so you don't want to build up years and years without having that. So that wouldn't be good for you either. And so you definitely, I mean, of course, the doctor wouldn't be able to tell you that, but you certainly don't want to have years on this. That wouldn't be healthy for you. But it's important to know the reason and to not just take a pill and just not figure out why you have really bad cramps. I mean, that wouldn't be healthy for anybody. And acne too, I mean, that should be the last resort for acne. That should be like after you tried everything else. It shouldn't be your first. I know a lot of doctors will just go to that first, but it shouldn't be your first step in treating acne.
Doctors prescribe birth control then.
It's just easy. I mean, it's just, they're basically just being lazy. And there's like, it's an easy answer. That's really the short answer is a lot of doctors will just, it's easy to say, take this medicine, you'll feel better.
Why does
And-
birth control help?
Because for acne, well, so usually it's hormonal imbalances that can cause acne. And so birth control can help balance the hormones. And you don't have, because usually if you're to see how the hormones change throughout the month, it's gonna be like a roller coaster. It's like up and down, up and down. But with birth control, it's just like a straight line. And so that can reduce things like acne. But it's not always healthy for you to do that. So I don't recommend doing that unless you've tried everything else for acne. It should not be done for that unless you really have to. Unless like the acne is like really bad and like really getting to you. Because birth control is just there's so many things that are so scary about birth control. There's so many bad side effects of birth control. It really can ruin your life if you take it. It can cause breast cancer, it can cause blood clotting. It can lead to so many different changes in the body, which are really bad for you. So
What does Accutane do?
Accutane, that removes the oil from your skin. And so that's also very scary. That also is not recommended unless you really have to.
It
That's
just,
also
like,
last
how does it
resort.
remove the oil?
Do what?
It just removes all the oil from your skin.
It just keeps you from making oil, basically, because when you have acne, you have oil glands that are blocked, and so you're secreting too much oil, and the bacteria feed on the oil. So Accutane just prevents you from making oil, so the bacteria aren't there anymore. You don't have any more acne. But that's that can be really bad for you.
Wait, then how come
So-
like when people on Accutane take pictures of like every month, it seems to like get worse before it gets better. Like it looks like all their acne like surface that they will ever have in their life came to their face, and then slowly goes away. Then they have all these scarring. Like,
Yeah.
why does it look like it
Yeah.
got worse?
Because at first that is what's going to happen. So at first, if your skin gets really dry, which is going to, your body just makes more and more oil right away, and that gives you more bacteria. But then eventually over time, once you remove all the oil, then the bacteria die out, and then you get clear skin.
Wait, but then would that cause like after you're done with Accutane, your body would keep making oil, right?
Yeah, but it can have
it's cleared
bad
out,
side effects. I mean, Accutane can have lifelong side effects in certain cases. They don't usually use that much anymore because it's just such a bad drug. Have they been using that on people recently? I didn't think they did. Because that'd be that'd be the last thing you should try, like after everything else, because it's not good for you to take that. Did you have a question, Carl?
Well, if you strip all the oil off, couldn't you get a moisturizer or some sort of oil just?
Yeah, you definitely would want to, with Accutane especially, you'd really want to moisturize your skin. But even still, it could still lead to long-term side effects. But yeah, that'd be very important to keep, because that'd make things a lot worse. Yeah.
Did acne itself actually become like an actual medical problem, or is it just?
Well, sure. I mean, it can be very, very painful. It can lead to a lot of pain on the skin. And so that's a medical problem. It can be disfiguring. So, but as far as, causing things like, hospitalization, no, but it can lead to pretty severe pain if it gets really bad. So for,
Sorry, is it true that like if you put like I know some people have like really like oily faces, so they won't put oil on their face, but like if you put like a type of like oil that's meant for your skin will like start to get used to it and not produce oil, so it's like you won't have dirty oil going on your face from your skin. You'll have clean oil. Does that make sense?
yeah.
Is that true? That's good for you, even if like just put it on before you go to bed, so not like.
Oh yeah, that definitely helps a lot. Yeah, I mean, good moisturizers are going to help a lot with preventing acne, because if you strip your face of oil, which you do when you clean your skin with soap, you need to replace that right away. Because if you don't replace it with moisturizer, your body's going to make more oil, which can lead to more acne. And so moisturizing is a very important step to prevent acne. If your skin is too dry, that's a big cause of acne.
Is it ever, can you take too many vitamin supplements?
Sure you can.
Is it bad to take vitamin supplements?
It depends on the kind of vitamin. So fat soluble vitamins are toxic in large amounts. Water soluble are not. So vitamins A, D, E, and K are fat soluble. And those can lead to buildup in your fat. That can lead to problems. That can be toxic.
What does vitamin E do?
Vitamin E, it's for your skin. Basically, it moisturizes your skin. But B and C are water soluble, which means you can't really overdose on vitamin B and C. Those are safe to take in large amounts. But the other ones, fat soluble vitamins, those can be overdosed on. Those can cause
What about like
problems.
zinc or iron?
You can overdose on those too. Those called liver problems. So those you do want to be careful with, especially iron. But those ones would be in the right amount would be fine. But if you overdose on those, that can lead to really serious liver problems. So what can happen with a stroke is that you can have bleeding in the brain or places of the brain where you don't have any blood going to. And that can lead to death of the neurons. Based on where the neuron death is, you can have different symptoms. So you can die from a stroke if it's in your brainstem, especially that controls your breathing and your heart. If you have it on the right side of your head, you might have paralysis in your left area because the right brain controls the left side of your body. And so if you have the motor cortex damaged on the right side of your brain, then you won't be able to move your left side. And so that's why lots of times with strokes, you see paralysis of part of the body. If you have the speech center damaged, then aphasia happens where you can't talk properly. You might forget how to say certain words. So sometimes what happens is that they know the word they want to say, but they can't say it. And so they have the word in their head, but they can't say it. Or they get words mixed up. And they think they're talking normally, and they're really not. And they, in their head, they hear the right sentence, but what comes out of their mouth is not the right words at all. So those are some things that can happen with strokes. Only about a third of people survive after 3 years of strokes. And so most people will die within 3 years after having a stroke. It's very fatal. Even if you do survive one, you're not the same afterwards. And many times you don't survive too long after one.
What percent?
1 in 3 people will survive after 3 years of a stroke.
Really?
Mhm.
Wait, do most people that have one stroke have another?
Yes, usually if you have one, it's a sign of other ones in the future.
Do you just have one and then not have one?
Do you want to?
Do you just have one and not have one?
You can, but it's more likely you're going to have more in the future if you have one. So as I mentioned before, if you have parts of the brain that are damaged, you can have other neurons that are not damaged migrate over and start to control the parts that were damaged. And so people who have strokes can relearn how to do certain things that they forgot how to do. So through therapy, they're able to learn how to walk again, talk, and things like that. This acronym tells you the things to look for in a stroke. So people have lost their balance, if they're dizzy, they have headaches, if they lose their vision, if they have cloudy vision, if their face droops to one side. So that would be paralysis, where the body's unable to control. Yeah, sure. So that's one of the big signs of having a stroke is that one side of the face is paralyzed, and you see that happen. Arm weakness, especially on one side of the body. Speech difficulty, they're talking nonsense. At that point, you want to call 911 because this is an emergency. Strokes require immediate attention. You need a matter of seconds to attend to a stroke before it gets worse.
Do seizures have to do with the nerves?
They do have to do with the nerves, but it's a totally different reason why you have a seizure. So for a stroke, you're losing blood flow to the brain. You're having neuron death. A seizure, you don't usually have any damage to your brain. So you have electricity firing through the brain, which causes a seizure. But on its own, a seizure usually is not harmful to your brain. Usually it doesn't cause any long-term damage. So usually seizures are not an emergency. They're usually, be a few minutes and they're over with and that's it. All right, so a stroke is when you have a full blood clot, but you also can have partial blockages. And that would be what this is, a transient ischemic attack, TIA. So this would be a temporary loss of blood to the brain. So this would be when you have a small blood clot, which unblocks pretty fast. And so you have the same symptoms as a stroke, but then it goes away. So you will have things like numbness, paralysis, impaired speech, but the blockage then goes away and you're better. So TIAs they'll be a sign of future strokes. So on their own, while they're temporary, you need to go to a doctor for this one too, because this is usually a sign of worse problems in the future.
Are we gonna learn about seizures at all?
Yes, that'll be probably tomorrow. We don't have time today for that. So strokes are always an emergency. Seizures are not always an emergency. That's one of the short answers for today. So strokes can be caused by, older age. You're more prone to strokes. High cholesterol, high blood pressure, smoking, abusing drugs. Those can all increase your chance of having a stroke. All right, well, we didn't get to the lab again today. I was hoping to get to that. We got sidetracked, but tomorrow, hopefully we'll do the lab. Yeah. Yes. You can die from a seizure, but it's not very likely. Most seizures are not an emergency. Most aren't going to cause harm. But yeah, it is possible, but not likely.
When I was 5 years old, I had a seizure and I